Okay, guys, welcome back to the IBS Freedom Podcast. I'm here with my co-host, Amy Hollenkamp.
Hello, everybody.
We are going to talk about SIBO, a topic that is near and dear to both of our hearts today. So how do you do, Amy? Let's get right into the nitty-gritty. Let's talk SIBO.
Oh, yeah, I'm pumped. I'm pumped for this. This is going to be awesome.
It's a huge topic, and this is going to be pretty much a topic that we're going to touch on numerous times throughout the life of this podcast. So we're not going to cover everything there is to know about SIBO in this talk. But first off, let's say somebody just, Mary off the street just went to her GI doctor and she just got diagnosed with SIBO. And there's a million questions running through her head. First of all, let's tell everybody, what is SIBO? Like from a conventional standpoint, like what does SIBO stand for and how is it viewed in the more conventional medical sense and also in the integrative field? And then we'll get into some of the things that we have noticed about SIBO and the things that we kind of go against the grain on. So first things first, what does SIBO stand for?
Yeah, so SIBO stands for small intestinal bacterial overgrowth. So as the name states, it's basically like an overgrowth of bacteria in the small intestines. And we were kind of talking before this. Well, what does that even mean? What does that even mean?
Yeah.
To me, again, like I almost view it as an imbalance of bacteria in the small intestines. You might have too much growth of a certain bacteria compared to other bacteria, and that's creating discomfort, bloating, diarrhea, constipation, a blend of both. So it's really driving very IBS-like symptoms. And SIBO in general is very much tied to IBS as well, which we talked about in another recent podcast. So, yeah. I think you want to kind of add on that?
Well, I was going to say that the studies are kind of all over the map. I think that some studies, when they've tried to look at, the diagnosis of SIBO within IBS, some studies are in the low, like 20 or 30% range of like 20 or 30% of people with IBS actually have SIBO. And then some studies go all the way up to like 80%. I think that a lot of people in the integrative space estimate somewhere between 70 and 80%. So definitely on the higher end of that. But regardless, quite a few people with IBS actually have SIBO as the foundation.
I think that like from my thinking, and because there's such a variance in what the percentage of IBS have SIBO even is, I think a lot of that is dependent on what method of testing people are using. So like a lot of the conventional docs, I mean, not at this point, but used to favor things like culturing methods to see if you have SIBO and overgrowth, which is essentially where they go in and it's more invasive. They go in like during an endoscopy and take a culture of your small intestines to see, hey, is there
suck out the juice.
Exactly. They go and suck out the juice and then see if you have an overgrowth or what they would consider an overgrowth of bacteria. And usually those studies are going to have lower levels. And there's problems with those studies. I think there's problems with the breath test too, but I'm sure we'll kind of talk all the ins and outs of this during this call.
Yeah, I think more clinically, certainly in like the holistic space and the integrative space where I practice, I mean, it's breath testing or bust. It's, I'm not in a clinic where I can even do an endoscopy if I wanted to, and like, nor would I want to. So I and most of my colleagues are not going to be doing an aspirate anytime soon, and that's okay. The thing that's really clinically useful and it's cheap and it's easy to do is going to be the breath test, but there is some issues with getting a breath test done. There's two different substrates that you could use. You'll basically drink a sugar solution to feed the bacteria, and then you breathe into tubes every 20 minutes for usually 3 hours and wait to see if those gases peak. Because that's really the gist with SIBO, is that the way that the bacteria cause you a lot of grief is because they make a lot of gas. And it's that gas that causes distension and discomfort and hypersensitivity and a lot of the symptomology that we think of with IBS. So it's a neat test, but it's not perfect. I've been a little bit hesitant to do a lot of SIBO breath testing on my patients because there is a fair whack of false negatives and potentially a couple of false positives with lactulose. But now we're thankfully getting better testing that's just kind of coming onto the market now.
Yeah, for sure. Yeah, I mean, I think where you have to be careful with the breath test is weeding out what could be driving false positives or false negatives. So really the breath test relies so heavily on transit time. And I think probably a big problem I see in the SIBO space is practitioners being very reliant on breath testing results. Like, breath testing results are all they're going by in terms of making decisions on what to do with treatment strategies. And that can be really problematic because there could be a reason why your levels are higher and you might have a false positive, and there also could be reasons why you have a false negative based on your transit times. But I mean, from my standpoint, you have to get a practitioner, or it would be more optimal to work with a practitioner that's taking in all the factors of your case and looking at, what are your symptoms? How are you presenting? Other testing to confirm certain things. So from my standpoint, I'm not a huge fan of like how heavily we rely on the breath tests in the functional integrative medicine space. I do think that, like you were saying, they're not a perfect test. So it almost has to be sussed out a little bit more and make sure that people you're looking at all the factors in people's case, not just going by a breath test.
Yeah. And I mean, there are cases like the way I kind of approach it clinically, I always talk to patients about the pros and cons. And like, realistically, if we do this test, it's going to be spending, $200 or $250 worth of your money. And there are cases, for example, like I started working with a woman, like on my questionnaires, I have a lot of questions about SIBO root causes. Like, have you ever had food poisoning? Have you ever had abdominal surgery and therefore adhesions? Diagnosis of this and that. And literally all of the root causes, like, have you ever taken a PPI? How long? All of them were positive. And I told her, I was like, I don't need a SIBO breath test for you because I'm so sure you have it. Literally everything is a positive. It's a yes on these questionnaires, and you have all the symptoms. And like, I think it's prudent to start working with you under the assumption of SIBO and just go off of that, because she's in such a vulnerable, inflamed state that I actually think that the SIBO breath test would flare her up quite a bit. Yeah. And that's something I think that gets overlooked too, is that the SIBO breath tests are intrinsically provocative tests, meaning if you have SIBO, they have the potential to make you feel worse. And the whole point is to cause that bloating and to cause that symptomology so that they can capture the gases in the breath test. So for some of my really vulnerable patients who are really, really struggling, I actually recommend against doing a SIBO breath test, and we'll try to get that sort of clinical information a different way, like through a proper history or maybe some different testing, stool testing, something that can help me put that pattern together and recognize the likelihood of SIBO without actually having to do that provocative test. So that's one of my hesitancies, is I don't recommend the test for everybody because they are going to flare up symptoms for some people, particularly if you have a nasty case of SIBO. And then, I actually did a SIBO breath test for my YouTube channel. I just did one so I could walk people through the process. And I did a glucose test. And this is another point, is that the glucose sugar actually flared me up, and I got really scary hypoglycemic from it. Like, I didn't actually measure my blood sugar, unfortunately. I wish I had thought of it. But I got very woozy, very lightheaded, shaky, and like clammy and sweaty. And luckily that didn't kick in until the 3-hour mark when I was done anyway. And I had food right there ready to go. Yeah. But it was the most hypoglycemic I've ever felt in my life. And it was pretty scary, actually, to do the glucose test. And then a couple days later, I got a full-blown vaginal yeast infection from the glucose. So,
oh my gosh.
Glucose tests are not without their consequences. But then with lactulose, there's, the transit time as a potential issue. So, I don't necessarily want to go into a great deal of detail on the testing, although I think we already have. But let's segue back from So SIBO breath tests are commonly used. They're maybe not perfect. There are pros and cons, but it is a tool that we have available to try to assess. But let's say that somebody got a positive SIBO breath test. With the conventional space, I'm sure you've witnessed this too, with like GI doctors and, even to some extent people in my profession in functional medicine, there's this kind of knee-jerk reflex that they hear overgrowth and they think, oh man, we've got to nuke it.
Yeah.
And that's where commonly it's all about killing and starving. And I know that was a path that you were on yourself with doing a SIBO diet and trying to just nuke the bacteria.
Yeah. I mean, I see it definitely a lot in the integrative space. I think the conventional space is really interesting because, and you can tell me if you've seen this, but I do think that a lot of docs think, okay, they did the antibiotics, it should be done. Like, we're done. Yeah. We're done dealing with this. Like, yeah, exactly.
Yeah.
We're going to wash our hands and we're done. Like, you fixed your SIBO, even though someone could be super symptomatic after taking rifaximin, which is the common antibiotic, and maybe paired with another antibiotic. So I do think there's that. But then sometimes in the conventional space, they're cycling through many rounds of antibiotics because that's their only tool to help with SIBO. And I think very similarly, like you had mentioned, the convention or the integrative space, when I was going through my SIBO, even they were pushing antibiotics. Like, they were trying to get me to go to my doctor, talk to them about what was going on, what we were trying to do, get antibiotics, in my case Cipro, which again, I wouldn't recommend Cipro for SIBO. Yeah. But it was basically the line that was fed to me is like, you're not going to feel better unless you take care of this with heavy duty antibiotics or rounds of herbals. So we did herbals and the antibiotics. But for me, it was like not necessarily, I think the herbals helped a little bit, but the antibiotics went very much overboard. And something that you probably see too with SIBO, there tends to be this like very narrow window of like where the clearing is helpful versus kind of hindering progress. Yeah. And I think for me, I definitely stepped over the line of clearing being helpful to clearing being somewhat harmful in my case. Yeah. And it's kind of a hard line to draw, especially when, like you were saying, many practitioners, that's their main tool of defense for an overgrowth is let's nuke it, let's bomb this baby. Well, you have an overabundance of bacteria in there, which is what SIBO is often presented as. And we talked about this in one of the podcasts we recorded, where there's this idea that your small intestine is supposed to be sterile. That was the popular idea that I heard in my SIBO journey, which is very untrue. There's a microbiome in the small intestinal space. Correct. And to me, I got really locked in on that idea too, because that was all I was hearing from my practitioners was, we had to hit this thing really hard. And it was really hard to get off of that mentality too. So I bought into that very hard and was very freaked out to feed my bacteria, very freaked out to try to change that trajectory away from killing. So this kill mentality is definitely something I see all the time and can be really problematic in terms of moving forward and progressing out of that phase, because clearing can be helpful. I don't want to paint the picture that it's not helpful, but that's just like the first phase of what you should be doing in just one tool in your toolbox, and it's not the only tool that should be used.
Hardly. It's not the whole enchilada. And that's that's as much as we in the integrative space criticize conventional medical professionals for just, prescribing a drug and being like, cool, you're done. I don't know. Like, I see the parallels where, all right, you go to your GI doctor. They say, you've got SIBO. Here's 10 days of rifaximin, and you're done. Yeah. Cool, we killed it. Move on with your life. See you never. And that obviously sucks. and only serves a small fraction of people. There are some people, I'm sure, who go and they get the one round of rifaximin and they're like, oh, and then they never get SIBO again.
Yeah.
But I think that they're in the minority. More frequently, either it will relapse immediately after that round of rifaximin, or it'll relapse within a couple of months because it was an incomplete half-assed treatment. But that's like the tools that they have. But that if you also look to, honestly, like 95% of people in the integrative space, where it's like, okay, you take oil of oregano and berberine and neem, like the trifecta, right? That everybody uses. Take these for a month or maybe 2 months, and then cool, you're good. And if you're lucky, there might be some conversation about leaky gut. And if you're lucky, there might be a conversation about a probiotic. And then it's kind of like, coolio, what, you're not responding, that why aren't you responding? And it's like, well, because you're kind of doing what the conventional world is doing. It's just you're doing it with hippy-dippy products instead of prescriptions. And like, it's green allopathy. You're using natural products, but in a very similar model. That's not necessarily the most integrative, holistic way to treat SIBO and to treat the individual person. So I see that quite a lot from the so-called integrative space.
Yeah, everyone gets very frustrated with the conventional space for being cookie cutter, but then a lot of the functional integrative SIBO protocols are very cookie cutter. Like you were saying, the neem, oregano oil, and berberine trifecta is definitely...
And maybe allicin, right?
Yeah, maybe throw in some allicin for some methane.
Yeah, exactly.
But yeah, it's definitely a bummer, because I just feel like a lot of times then people are looking for different options and going to different maybe functional docs, but it's the same strategy, just kind of hit it really hard. And there's never a rebuild and repair phase to the model. It's the clearance-based model.
Yeah, I think certainly not for the microbiome. Like I said, I think if you're lucky, I think most integrative practitioners and naturopaths, most of them are going to touch on leaky gut, and they're going to send you home with like some glutamine or whatever their product of choice might be. And a lot of them will eventually get to the place where they recommend like a probiotic. But most of the work, like still 80% of what they're doing in my experience for SIBO, is focusing on the killing. Like everybody has their products. You're going to run into the practitioners who swear by biocidin and they'll use nothing else. And you'll see the practitioners who just do like the Alison Seebecker model and that protocol. And it's very cookie cutter modeling after her. And it's like, it's, I don't know, I don't want to say it's tougher than that, because I don't find SIBO especially hard to treat, honestly, anymore. I think that I've got a pretty good handle on most cases. But it's just, you've got to use your noodle a little bit more than that. And I do find that even people in my profession, they want the protocols. They want the cookie cutter, and they want to make it as easy as possible. And this is why, like, I'm in a program right now studying herbal medicine with herbalists, because I've realized the way that the integrative and functional medicine profession treats herbs is too allopathic for my liking. And again, it's like, this knee jerk of like, oh, you have bacteria, oregano. Oh, you have a UTI, you need uva ursi. And I want to know herbs more completely than that. And I want to understand like what they have the capability of doing. And I think, I started realizing when I started going to herbal medicine conferences that when, for example, if an herbalist is talking about detoxification, they're talking about a whole myriad of different herbs that you could use depending on the constitution of the individual and what other health stuff they have going on. And it's very tailored to that person. And in my own profession in functional medicine, I see this like, each practitioner has their detox product of choice, their binder of choice, their leaky gut healer upper of choice. And it's actually a little bit too cookie cutter. That's probably another topic for another day, but I do find that a lot is protocol driven even within this space, and it drives me a little bit bananas because it's not quite that simple.
No, I think like that would be a really cool topic just from my standpoint to hear about kind of what you're learning from an herbal standpoint in the fun facts in that world, because again, I'm fascinated by what you're learning in the herbal medicine space, and getting like a really fine-tuned handle on herbs is really cool.
Yeah, I'm thoroughly enjoying it so far. But yeah, I think that, going back to the topic at hand, I think that, killing shit is a piece of the SIBO journey for most people, right?
Yeah.
Like, there's going to be some degree of, you genuinely have an overgrowth of a bacteria or two, or who knows how many. And trimming that back and getting that population more under control is a piece of it. But we also have to focus on the checks and balances that keep SIBO from happening in the first place. Otherwise, you're going to nuke stuff, and then it's going to grow, because that's what bacteria do. They reproduce and they grow again. And if you have an environment that allows for that stasis and allows for that growth of the bacteria again, you're just going to be faced with the same issue over and over again. And I've seen so many patients who come and see me after they've been on literally 10 rounds of Xifaxan, or 10 rounds of the Candibactin AR and BR, or 10 rounds of whatever. And you've got to do something different, and you've got to bolster your own ability to ward off SIBO. And that's something I tell all of my patients too, is that, and I'm going to borrow from one of your recent favorites on my Instagram post, you don't get SIBO willy-nilly. That just doesn't happen. I'm 85 years old at heart, side note, so I love words like willy-nilly. But, it's not like your body is marching along through life and then one day your body goes, what would be rad? More bacteria in the small intestine. Let's do that. Like, that isn't a thing. There had to be a breakdown of some protective mechanism or some check and balance system in your body that allowed that mischief to happen. It's not like just one day you woke up and had SIBO. Some domino had to fall into place to get you to that point. And trying to understand that and work on that to the best of your ability is absolutely the most important piece of the SIBO journey. Like, by all means, kill the stuff, work on motility, but like, manage your root causes to the best of your ability and try to prevent it from happening again.
You are hitting the nail on the head and speaking my language, even with the willy-nilly. But one thing that's super fascinating about what you're saying is that even in the conventional space, there's this understanding, or at least like I've heard conventional docs say, like SIBO's a secondary condition, but then like there's no plan beyond the clearing. So like I think there is this acknowledgement, even in the conventional and integrative space, that SIBO is a secondary issue. So it's happening because there's some delay in motility or some sort of insufficiency in digestion or other kind of root causes that are driving these breakdowns. But yeah, I think it's really, really important just to keep in mind that SIBO is a symptom. And unless you drill down to the root causal issues, it's always going to be a problem.
Exactly.
And I did want to make one other point about like the constant rounds of different antibiotics or herbals, is that I do find, and it happened to me a whole bunch in my journey, was just this idea that, okay, if the bloat's still there after you clear, that means like for sure the SIBO's there. Like I do find that a lot of practitioners tend to treat based on symptoms alone, but I mean like long term. So like long term, they say like, okay, if you're still bloated after these things, it's SIBO and we have to keep killing it. Is that something you see often too, is like this idea of, if you have any unresolved symptoms, it's SIBO and we need to keep killing, like after you do a round of herbals? Or
sort of. And I'm a teeny bit guilty of it to some degree. I think because I'm just not a huge fan of breath testing. Like I've seen, the Allison Seebeckers of the world where it's so protocol. It's like 30 days of killing, wait 2 weeks, repeat breath test. 30 days of killing, wait 2 weeks, new breath test. And my usual kind of game, the way that I usually do it is I'll have somebody do a round of antimicrobials. And we're already working on things like your digestive capacity, nutrition, like as much diversity in your diet as possible, digestive enzymes if need be, HCl if need be, prokinetics, pretty much across the board with everybody I do prokinetics in some way, shape, or form. So we're already working on a lot of the foundational stuff by that point. And once I get them to a point where we do antimicrobials, I usually have people go off of them intentionally. So I'll tell people, all right, you've got enough for 30 days. We're going to book our next appointment for day 34 so that you've had about 3 days to kind of reassess and see where your baseline is. And at that point, if you feel great and you feel like you have not backslid at all, okay, cool, we're done killing shit. Let's move on to probiotics or some other stuff. If you feel like you noticeably backslide and old symptoms return, like old symptoms that got better on the antimicrobials, if those symptoms return within that quick couple of day time frame, and it's noticeable and clear that it's a result from going off the antimicrobials, usually I am pretty willing to say maybe another round is prudent. And I'll do that up until a point, like maybe 2 or 3 rounds of natural herbals, but we're always doing something else in the mix too.
Yeah, so, for sure.
Okay, let's say, like I'm thinking of one case right now, but for example, this woman, we did round 1 and we added in, we already had her on prokinetic, we already had her on some leaky gut stuff, I think, and some sort of like adrenal tincture, I think, if I remember correctly. And then she felt like she noticeably backslid. A couple days later, we talked about it. We're like, all right, let's restart the antimicrobials. And this time we added lion's mane. And that notably helped, like profoundly helped. But now this time we're talking about, all right, after the second round of antimicrobials, she backslid a little bit, not nearly as bad. And the couple of things that we have in place are really working well. But now we're debating, all right, do we do a little bit more? Do we do a third round? Or do we need to move on to greener pastures and work on, candida, leaky gut, whatever it might be? So, yeah, I think there is a time and a place for that approach, but I try to keep a pretty close eye on people. And again, it's like if a certain symptom definitely went away when we were on a killing spree, and it definitely relapsed within like 2 days of ending an antimicrobial, then I'm usually willing to say, all right, some degree of manipulation and working on that ecosystem is still in order. Now, at that point, too, I might order something like a stool test, because now I'm wondering, all right, is there like some good bacteria we need to nurture or some strategic things we could do nutritionally to work on the broader dysbiosis picture? Or I might be rerunning labs through like LabCorp or Quest and monitoring things like C-reactive protein or their inflammatory levels and see if there's some targeted support we could do that way. But I think there's usually some sort of reassessment at those points. I don't necessarily do a knee-jerk reflex to go into antimicrobials. There is some degree of reassessment in between, and then we have a conversation about whether or not it's prudent.
No, and I don't think that was really I think what you're doing makes total sense, where it's like you have to see how you're going to do after the herbals a little bit. I see a lot of people too that like don't get any benefit from the herbals or from the rifaximin, and then they're just doing round after round in hopes that these things work. Yeah. And that the SIBO's still there driving the bloating. That's kind of mainly what I'm talking about. Is like this kind of knee jerk, like SIBO's the only thing that could be driving the bloating.
Yeah, no.
When there's
that's a whole different enchilada.
Yeah, there could be so many different things going on gut-wise that are driving continual bloat following antibiotics, or just never went away with antibiotics or herbals. And I think that that's something to be really, really a little bit leery of, and to try to avoid if possible, not to keep doing something that's not working at all, just because it's the model that's really popular is to clear. If the clearing model hasn't worked or you haven't really noticed symptom relief, there could be another issue at play. Or you need to switch something up. Don't just do the same thing over and over again, expecting a different result.
Yeah, exactly. And that's a completely different ballpark. And I have had those patients where, and I'm sure you've seen this too, or I've had patients where they're like, I did rifaximin once and I felt great. I did it again and I felt a little bit better. And then I did it a third or a fourth or a fifth time and nothing. Yeah. And it's like, okay, so that's a point of diminishing returns. Killing the stuff helped to a certain point, but now you're clearly at a state where you need more healing and support, and you're not going to kill your way to beating this. You need to actually work on your health, work on your motility, work on something else. And that's usually the point where people will find, probably either of us is like, all right, I tried the conventional thing. It clearly didn't work. But those are the points where it's like, don't keep doing round after round of oregano or whatever it might be. If you didn't feel a difference, then clearly killing the stuff is not the biggest piece of the puzzle for you.
Yeah, for sure.
If it's a piece at all.
Exactly. No, I totally agree. And I think we could also talk about, do you want to just touch on should we touch on symptoms? I know we kind of touched a little bit on them, but I feel like there's such a broad range of symptoms associated with SIBO, or even some of the root causal issues that could be happening underneath SIBO. I think a lot of times SIBO gets SIBO's to blame for my fatigue, SIBO's to blame for everything that's going wrong in the body, and I do think it affects so many different things. So I'm not saying that it can't be at play, but there's probably a lot of other things in the SIBO realm, or what's driving the SIBO, that's really creating a lot of the symptoms.
Yeah, and to be fair, this happens all day, every day with SIBO, but it also happens with other conditions too.
Yeah, for
once
sure.
people get diagnosed with Lyme disease, they're like, Lyme disease explains everything, or mold exposure explains everything, or histamine intolerance, and it's yes and no, because again, infections are kind of a different story. So Lyme disease, that's a whole nother squirrely world in itself. But again, your body didn't just decide one day to be histamine intolerant, or FODMAP intolerant, or have SIBO, or have dysbiosis. Something had to happen to get you to that point. But yeah, I think let's touch on symptoms for now. And then I think that SIBO root causes would actually be a really great topic for a whole nother podcast, because I don't know about you, but I could talk about each of these root causes and probably fill up an entire podcast doing that.
Oh, so
we'll keep the listeners in suspense for the moment. And or they could just go read either of our blogs or Instagram or Facebook posts, and they'll see more about that.
And I do think even just separating each root cause could be a podcast in and of itself. So
I agree. I think that at least the couple of big biggies that I see most frequently, we could do a podcast on each of those. But we'll table that conversation for the moment, and we'll keep people in suspense. But symptoms. So what would you say are your top, let's do a top 5 symptoms that you see people come in with SIBO? You first.
Yeah, well, definitely bloating.
Totes my goats.
Bloating's big. I would say usually there's either constipation or diarrhea, or both, some sort of mixture there. I get a lot of fatigue. I don't know, again, if that's being undernourished or a mixture of what's going on SIBO-wise, but I see a lot of fatigue. I see a lot of brain fog. I don't know if that's something that you see a lot of.
Virtually every one of my patients has brain fog, to a point where part of my shtick with my way I do practice is I record all of the appointments, and I give people access to the audio files or the video files, or both, from if we do a Zoom call or an in-person appointment. I record all of the appointments and I upload them to a folder for people, because every one of my patients has brain fog and they don't remember half the stuff we talked about. And I'm just here, you can listen to it again and again. That's part of my deal. So totally common.
So brain fog's definitely one. I think another huge one that I'm seeing often is any sort of mood. There's different kind of mood swing issues, but I see a lot of anxiety, a lot of depression. Those are probably my top 5. There's some other things that I see a decent amount of, hair loss. I see a decent amount of hormonal issues in general, sometimes cyclical issues hormonally. Those would be the biggies. Or do you have any to add to that? I'm sure you do.
Yeah, I mean, I think that local to the GI tract, I think the biggest symptoms are bloating. I would add abdominal pain, or
for sure,
tenderness or cramping, something like that visceral hypersensitivity that goes with IBS is quite common. And then some presentation of diarrhea, constipation, or a mixed presentation or yo-yoing back and forth. Although I don't know about you, I've also seen people with full-blown diagnosed SIBO who are completely asymptomatic in the gut, and then they have other stuff going on. Like, I'll never forget this guy who came in. I grilled him like you wouldn't believe. I asked him, how often do you poop? What do your poops look like? What do they smell like? Like, what color are they? Do you have any of this? Do you have reflux, heartburn, indigestion? Nothing. And his one and only complaint was that he had a full body rash that would not go away. He had it for 2 years. And bless their hearts, the conventional medical folk just kept giving him steroid after steroid, both topical and oral. And after about 2 years of that game, he was like, this is ridiculous. Enough's enough. And turns out, I just went on a hunch and I ran basically like a fancy leaky gut test, more or less.
Yeah.
And with like LPS antibodies. And then a SIBO test. And I think we might have done a stool test. This was a couple years ago now. But what I remember distinctly is he was on, we got him on some antimicrobials, herbals, for the SIBO. 3 days into taking the antimicrobials, he texted me and said, rash is 98% of the way gone.
Yeah, it's crazy.
3 days. And he had been struggling with this for 2 years. And obviously we finished out the course of antimicrobials. We worked on a couple of other minor things. Like I think his testosterone was like low normal for his age. But we worked on some other kind of minor things. He's been fine ever since. I have not heard a peep from him, which I'm assuming means that he's still doing A-okay. But he had no gut symptoms whatsoever. None. And it still boggles my mind.
That's really interesting. I don't think I've had someone that's been totally asymptomatic gut-wise, but I've had people that have had, perfect poops. Mm-hmm. Or like, they don't appear to be constipated or having diarrhea, but just have like bloating. And they don't have any pain. They don't seem to have any other issues. But all they have is this like kind of horrible bloating. And like it's not really disruptive. It's just very annoying, and like they don't like having this bloated. They like there's something wrong, for sure, with why they're bloating, but they don't really have any other symptoms. I've definitely seen that. But yeah, I'm sure there's people out there that have SIBO that are asymptomatic and just dysbiosis in general, gut imbalances in general. Oh yeah. That don't have a manifestation of gut-related symptoms. Yeah. So I think, like I said, I think gut-wise, cramping or pain, something like that, bloating, stool changes. I think anxiety is a big biggie. I see a lot of anxiety that improves with antimicrobial therapy and working on the SIBO. And I wonder if some of that is from like the microbial connection itself and the LPS and the inflammation, or I think that some of it probably is honestly like a variant of PTSD from dealing with all of this crap of being chronically sick, feeling like your doctors aren't listening, like they don't give a crap, like all of that. I tell practically every patient that I see that I think medically induced PTSD is a very real thing. And if you've gotten to the point where you're at my door or you're talking to me on the phone, you probably have been traumatized by either your health or your medical providers or both by the time you find me. And I see that a lot. So I don't know how much of it is directly microbial versus just like shitty circumstances. Like I just spoke with a woman this week for our first appointment, and we were talking about her sleep, and she was sleeping really crappily, and she said, well, that's actually improved in the last week or so since I filled out all the paperwork for you. Just since we did our free little like welcome call and we spoke on the phone, I'm feeling a lot more hopeful and a lot less doomed. So I've already been sleeping better. And I feel like my mental health is already improved just to have somebody who listens and cares and seems like they know what they're doing. So I think that 100%.
It's both.
And I think that I do think that when it comes to dealing with SIBO, there is trauma there that occurs, and with the food fears and the restrictions and trying to manage like insane dietary restrictions long term. Yeah. I think even that just takes a huge toll on people. Oh, totally. And it's basically zapping their energy. It's it's taking up all of their energy, and they can't focus on the things they enjoy. Like their whole life sort of revolves around having SIBO.
Yep.
And you can't really progress if you're not doing the things you enjoy and finding pleasure and in your life. And like you're saying, there definitely could be a microbial component. I've definitely seen people who don't appear to be overly stressed or traumatized, but like are like literally all of a sudden I got food poisoning and I was an anxious wreck after this food poisoning incident. So there are people that I think it is more of a microbial, there's a microbial component there. And then I think there's others where it's like just the situation is driving the anxiety, or maybe a blend of the two. But it is really fascinating. I'd probably say like 90% of my clients have anxiety as a part of their profile in some capacity.
Yeah, I agree. I think probably a similar statistic for my patients as well. And I think it's coming from both places. And I remember like this one woman, I forget what, she did like this weird protocol. And you have to like love and hate the internet sometimes for this kind of stuff. She wanted to get pregnant and they were trying to conceive, and she Googled and found this method where you take Nexium and Claritin for 30 days. I'm not even kidding. You take like a PPI and Claritin for 30 days, and it's supposed to help you get pregnant. Lord only knows how. And she did that. And then it didn't work after, 30 days or 60 days or something. So she said, well, the hell with this. And she went off of it and abruptly stopped the PPI and the Claritin, and she got this really bad rebound reflux because she just went off it cold turkey. And then pretty much immediately thereafter, she started having pretty severe IBS symptoms and very like 10 out of 10 anxiety and panic attacks, could not function. And she like barely made it to my office for the appointment because she was having a panic attack and her husband had to come with her. And she was another case where like 4 days into the antimicrobials, the panic attacks were gone. She was able to go to like a co-working space and start working a little bit again. And it was just this like damn near miraculous turnaround. It's like, okay, like that's pretty profound. So
for sure.
I think the microbial connection is there for sure.
Definitely. And I do think loosening the reins if you are too restrictive or your life's revolving around SIBO, noticing if that's related to the anxiety can be really important to make sure you're prioritizing pleasure and fun, enjoyment as much as you can. I know if you're not feeling great, I'm not expecting you to be like out there every day doing something fun, but like
competing in Ninja Warrior trials.
Exactly. But I remember in my journey, like a big positive thing, even when I wasn't necessarily 100%, I started playing basketball again, and I played basketball in college very briefly. So it was like always a very big part of my life. And I remember like how like just exciting and fun that was to be able to do that again. And I think even in my head, there was like a piece of me that's like, oh, I can't do this. I think you get into this mentality of like, oh, I can't do something because I have SIBO. It might aggravate my symptoms. Like you're just constantly thinking about it instead of just being like, okay, I'm going to try and see how I do. And if it works, awesome. But it was really fun. Sometimes I had to like watch and see like how long I was playing so that I wasn't getting too fatigued, because that was still like a part of my equation as well. But it was super fun, like really exciting, and helped me a lot in the healing process. And it wasn't like a supplement or a diet. It was like just living life in a way that was helpful in my journey and allowed me to have fun and pleasure in a woo-woo way, like kind of ignites your soul. I think if you don't have anything that's like giving you pleasure or life, it really can prevent progress. And that's something I definitely discuss a lot with my clients. Like, how can you incorporate more life into your day or week so that, again, your whole life isn't revolving around this one thing?
Yeah. And they've done studies. I don't have the numbers or anything handy, but this could be a topic for another podcast. They've done studies where they try to assess whether you have like a purpose in life, or if you have a community and support around you. And pretty consistently, people who don't have that support around them, or they don't have that like passion for life, or they don't have hobbies, they don't have pleasure in their life, consistently have more chronic disease, and they're more inflamed. Like, they measure inflammatory markers and it makes you more inflamed. So this isn't just, yes, there's the matter of if you're profoundly sick or profoundly fatigued, the likelihood of you going out and about is less likely just because you're fatigued. I think this also has a direct effect on our bodies and our inflammatory potential. And that's something too, is that if you're inflamed, nothing works like it should. Your brain doesn't like inflammation. Your pancreas doesn't like inflammation. Your right big toe doesn't like inflammation. Nothing likes inflammation in your body. It's a necessary thing. Sometimes you need to be inflamed if you're injured or if you're sick or you have an infection. But if you're always flamed out on a day-to-day and you're trying to get like your gut lining to heal, or you're trying to wrangle your microbes into place, or you're trying to get your motility and your gut-brain axis to work again, it's going to be so much more of an uphill battle, because nothing works when you're inflamed. So if you can work on inflammation through something like this, like picking up a hobby again, or hanging out with friends more, or having that connection, like hell, even us starting this podcast, I enjoy talking to you so much. I'm sure that I'm lowering my inflammation on some level just talking to you, because it's just so enjoyable to nerd out with somebody who like gets it. And I think that stuff like this oftentimes gets overlooked. I don't know if it's because it's like too woo-woo, or we don't have as much hard data on it, or it's harder to track it, but it could be so profoundly impactful. And so, I mean, dare I say it, life-changing, to get that out of life again and start living your life truly.
Yeah, and this could also be another topic too for another day, just like when your life does very much revolve around SIBO and you can't see outside of it. I think there's an inability to see yourself outside of SIBO that can be like really trapping in a way. Again, another woo-woo thing that sometimes I'll do with my clients that are in like a very like, they've done this so many times that they're just kind of in a negative headspace about their SIBO, which again, definitely happens. I think for me, it certainly happened, but they've tried so many things. Maybe they're scared to try new things. But doing visualization practices, I think, can be helpful, where you kind of visualize yourself being well, doing the things you want to do, like being with the people you want to be with. Joe Dispenza, do you know him? He's kind of a big meditation guy. In one of his books that I find pretty interesting with the visualizations is to kind of pair it with the emotions you'd feel if that actually happened. Like, that's what kind of brings a visualization to a whole different level, is you're basically like tricking your mind into having that experience, and it affects the body. It gets all like very hippy dippy, but really cool.
But also some pretty hardcore neuro too. Like, this is neurology at work, but continue. Exactly.
No, exactly. So I think even just seeing something in your head, and if you're kind of revisiting it, not necessarily on a daily basis, but you have some sort of pattern of like, okay, this is what I want, this is the future I want, and you can start to at least open the door where you're seeing yourself outside of SIBO. That can be really, really important in a huge hurdle to overcome in certain situations. If you've been down this road for a long time and you're just kind of mentally shot, being able to overcome some of the mental hurdles can be hard at times. I don't know if you've seen that with your clients as well.
Yeah, and I would say too that to some degree this isn't unique to SIBO. Like, I've seen this. The chronic Lyme crowd will identify, like, it's like your identity becomes tied up with this diagnosis. And I think that this goes back to, we've talked about before, my love-hate relationship with Facebook forums. And even ironically YouTube, even though I love YouTube and I'm on YouTube, but like, you know, you start to build some friendships and some degree of a bond with people in these groups, and you're helping each other. And it's like, I don't know, on some level, they are your people. And again, it's like you start to kind of fold yourself in with that diagnosis and that group, and it becomes less clear separating yourself and picturing your life if you weren't a part of that world again. So I think finding something else, like for you, you know, if somebody had asked you in that moment when you got back into basketball, for example, like, all right, describe yourself. Like if this is like a dating profile, like describe yourself in, 2 sentences or less. Now at least you could add, basketball player, basketball enthusiast to your list of adjectives or things that you would describe yourself as, instead of just, I am reading a lot about gut health and I'm like on this healing journey, and that's not the entirety of who you are. You feel like you have some purpose or some space for yourself outside of that diagnosis, which I think is important.
Yeah, it's like the way I sort of picture it is that like the longer someone's been through the SIBO space, it's like that door, it's like a door's open for you to get better. And then like as you've gone through round after round, the door kind of closes and it feels like there's not much hope, and then sort of like it slams shut and you're like, you just can't see outside of SIBO anymore. Yeah. When you get to that place, I think it's really important to like really try to get back into some sort of flow where you're seeing yourself outside of it, whether it's visualizations or finding time within your week to do things you enjoy. And that doesn't have to be basketball. It can be playing games with your family. It can be going to unfortunately, I think COVID makes it a little more challenging, but it could mean drawing or going to a class or whatever seems to like soothe your soul in some way. Yeah. And it allows you to be a person outside of SIBO. Can be really powerful, not only just like for you in that moment, but I also think just from a mental standpoint.
And I want to be clear too, this is absolutely not conscious and intentional on the part of the individual. It's not like, if you're listening to this, it's not like we're saying that you're a kook and that you on some level are like, I love my SIBO friends and my SIBO group and I never want to leave them and I'm one of them, damn it. Like nobody in their right mind would willingly keep themselves sick in order to like connect with people in a Facebook group. So we're not saying that this is at all a conscious or intentional thing, but I think on some weird, esoterical, like out there level, I think that starts to happen, and it consumes your life so much that it can be hard to get out of that position or that predicament. And that's where it's like you kind of throw yourself a rope so you can get out of that rut and you can have something else to tether yourself to. Even if it seems silly in the moment, I think it could be really important.
No, totally. It's very subconscious. It's not like you don't want to be better. You definitely want to get better, and you're probably trying like everything in your power to get better, but like it's consuming you in so many different ways. And there's a lot of power in sort of taking your life back in some way, or finding what your life looks like outside of SIBO. And that can be kind of small baby steps. But it is a really important step for a lot of the clients that I work with, is making sure that there's like some amount of pleasure, fun, joy, or again, that they're doing some work to at least start visualizing what they want outside of SIBO. Visualization
goals.
Visualization studies are really fascinating too. I don't know if you've ever kind of gotten into the weeds on those.
Not a lot, but that would be an interesting topic for another day for sure. Because I think I would have a lot to learn from you, it sounds like. It sounds like you have nerded out on that topic a bit more than I have.
I would say I'm like probably in the earlier processes of my nerd out, but it's like something that's very fascinating to me. I've kind of Bruce Lipton, do you know Biology of Belief? That it's kind of like a famous book, but it kind of is in line with that from what I'm reading.
Okay.
How kind of your beliefs and thoughts affect your biology is very fascinating from my standpoint. Just because I think my personal journey with SIBO, like looking back, I can see a lot of like the negative thoughts, beliefs that kept me unwell for a longer period of time. And
sucked you into the vortex.
Yeah, and I think changing those beliefs and thoughts were really a big part of my recovery in some ways. So I just think it's not something that's really discussed very much, is like the mental side of SIBO and gut repair in general, or just chronic illness, like the mental side of chronic illness in general, in how to manage that and how to make sure your beliefs aren't kind of keeping you in a not great place. And like you said, it's totally unintentional. It's a lot of subconscious thinking, but it's a really cool, interesting rabbit hole you can go down.
Yeah, well, I look forward to that nerd out sometime in the near future then. But I think this is a great place to wrap up the SIBO conversation for the day, at least. Guys, if you would do us a favor, rate us 5 stars on whatever, podcasting platform you're listening to, iTunes, Spotify, whatever it might be. If you are on YouTube watching this, then go ahead and comment, subscribe to the video or the channel so that you get more updates, and we will see you guys in the next episode. Amy, until next time.
See you later.